Good evening. My name is Debbie Hill. Welcome to Family Night at Hill Alcohol and Drug Counseling. Tonight's lecture is again on the family system, and tonight the goal is that everybody in the family system would begin to understand exactly what's happening to the family as a whole. And let's start out by looking at and beginning to ask ourselves the question, what are families about? What is it that we want from our family system? And I don't know about you, but I remember as a child, and this will tell you a little bit about how old I am, I remember watching TV shows like Ozzie and Harriet and Leave It to Beaver and Father Knows Best. And for those of you that aren't quite as old as I am, you know, you might think about the Huxtables and those people. The Brady Bunch, well, I guess that would make you kind of old too. But the ideal families that are portrayed on television, and what I knew as a child was that somehow my family didn't look like that. My family didn't fit that. And I began to feel at a very early age a sense of shame and secrecy because I had that little knowing that there was something different about my family, and my sense was that what was different about my family didn't exist in other families around our neighborhood. And the thing that was different in my family, or at least what I thought was so different in my family, was the fact that in my family, my father was an alcoholic. And I may not have always understood exactly what that meant, but what I did understand at an early age was that that created a sense of secrecy and shame. And so tonight what we're going to talk about is this term that we're probably all familiar with. That's a D. Dysfunctional families. Most people are really sick of this term. And if you are, I'm sorry to bring this up one more time, but this is important that we look at this. We need to look at what we're actually talking about when we talk about a family system that has become dysfunctional.